In spite of the $2.5 trillion that we spend on healthcare each year in this country, the quality of the care, as I mentioned, is too often mediocre, poor, or unsafe. We at the Robert Wood Johnson Foundation chose to take these challenges on with leaders like you in communities across the nation.
And that's why 6 years ago, our foundation made a pretty big decision. We decided to invest all of our resources in a limited number of chosen communities or regions.
We decided to move beyond working with one clinic or one hospital at a time or one disease or one condition at a time. And instead, we launched the Aligning Forces for Quality initiative as our signature effort to help communities like yours lift the overall quality of care in their communities, making sure that we're not forgetting about racial and ethnic health care disparities while we're doing that. We believe that locally focused initiatives are the most promising paths toward creating health care that consistently and reliably produces high value.
Starting with places like Buffalo, Western New York, Detroit, Kansas City, Memphis, Seattle, but eventually spreading to the rest of the country.
Across the country, there's now 17 Aligning Forces markets. They range from the state of Maine to Humboldt County, California. And we brought together people like you, the men and women who give care, get care, and pay for care to work in collaboration.
We can no longer continue to have the silos of physicians talking to physicians, hospitals talking to hospitals. We really need to involve and make it a community effort.
We all know employers provide health insurance benefits to 160 million Americans.
So, in my mind, everybody's got a role. Government levels the playing field. They're also a purchaser, employer's message to workers. Increasingly, we have got to say, look, it's the worker's duty to be well. If we all are insured together and I don't take care of myself, it isn't a guess whether I'm going to cost you money, right? I am going to cost you money, and is that right? Let's do that shared decision-making adherence thing. If you make a decision with your doc, you're not sure whether it's got a big impact or not, hang in there until you get a chance to interact with them again about whether or not your decision not to take that medication matters or not.
Let's tell hospitals that have high rates of readmission or have lots of hospital infections, you're not going to get as much money.
So let's not be making co-pays for folks who have chronic diseases that we really want care for. Let's make sure that we get care close to people. We need to manage the clinical risk.
Let's publish all this information in a simple, widely, easy to read, format.
Because of the great work in the Aligning Forces communities, like the Minnesota community measurement work, all of you are uniquely positioned to be the nation's leading innovators for this kind of work.
And it's mostly because we haven't stood up and said, here's what's important to measure, and we want to measure it. We want to measure the good outcomes. People would be thrilled to death. We would not have to fight about that. And then, once we did that, we could say, well, if there's some process measure that we absolutely know is key, like don't forget to put a heart back in when you're doing a heart transplant.
You guys get it. You get that it takes the people who give care, the people who get care, and the people who pay for care working together to improve quality of healthcare. The other thing I think I see here is just a very strong civic culture around collaboration, around the people here have been here for a while, they live here, their roots are here, they want to make this a better community.
Information, improvement, and engagement, all working simultaneously and in concert to drive toward high-quality, high-value care. Aligning Forces communities are already making fundamental and cutting-edge changes to rebuild healthcare and help drive reform.
If you guys are successful in what you're trying to do here and improve coordinated care, focus on prevention, you do all the things that we talk about in the healthcare business, then you'll kind of lead the way in terms of making our healthcare system better. But you're also change agents because people listen to you. You're members of a community. You're members of a local community. You're members of a state community. You're members of a national community. What you say has relevance.
We know that in Albuquerque and in New Mexico, we are can-do people. We see a problem and we all come together to work on it and try to fix it. But sometimes we become a little bit latent, I'd say, and don't quite have the extra force that we need to move things forward. And I can tell you that from this initiative being launched here, it has really created a new level of energy and collaboration in our healthcare community. coming together.
At the time we had a national competition, we looked for regions who could bring to the table a partnership between, again, we use this expression, the people who give care, the people who get care, and the people who pay for care. Employers are important, they can't do it alone. Physicians are important, and hospitals, they can't do it alone, and neither can consumers.
I want to leave you with 3 points on behalf, again, of all my colleagues at the foundation and at the program office. First, we're very proud to be working for you. It's incredibly inspiring to see all the intensity and the progress that you're making. Second, we have incredibly high hopes for you, and that unfortunately comes along with some expectations, so there's that. And then third, as we go across the country, you can really see this happening. The transformation in healthcare value has really begun. It really has. But again, you've only gotten started.
And you all can help us as we move along in that journey. Because again, it's not any one of us. If I've learned anything in my years in healthcare, we heard earlier, the healthcare system can't fix healthcare by themselves, and we can't fix people's health. It really is the combination of everyone. Consumers understanding and being more involved in their own health care, becoming better partners with their health providers,